Welcome to the Society of Hospital Medicine's Education Consult Series, brought to you by the SHM Academic Committee. This series is dedicated to providing hospitalists with practical, easy-to-use teaching techniques, tips, and resources from academic clinician educators. My name is Dan McFarlane, and I'm here with Jennifer Readlynn of the University of Rochester, and we're going to talk today about feedback.
Thanks for having me, Dan.
Let's talk about what we're going to learn today. So we're going to have some learning objectives. So we're going to look at the factors that contribute to providing effective feedback. We're going to provide low stakes formative feedback, and we're going to develop a plan to provide evaluation feedback based on a specific model called the spikes model. So Jen, tell me what's going on with you.
So I have a really great team. I just don't know what to say to them to provide them feedback. They work really hard, they try really hard, but I'm not sure what to tell them. I don't want them to feel bad if I tell them anything that's too negative or negative at all. And I don't want them to worry about their grades, the students on the team either.
I think that's a really common problem that we have. I mean, I think that feedback is scary, right? I mean, feedback, I think is scary to kind of everybody, the learner, as well as the giver of the feedback, right? The teacher. And so I think there's a stigma of feedback. Students are fearful of the grade and the competition that entails, and sort of being compared or judged to their fellow learners, and faculty are kind of afraid of hurting people's feelings. I think I've made people cry before. I don't know if you've ever experienced that, but that can be really difficult to manage.
Yeah.
So one of the things that I have found to really kind of change the way that I give feedback is really thinking about what the purpose of feedback is. So the purpose of feedback really is to help learners improve. And I tell my learners that up front, right? So there's really kind of two kinds of feedback: appreciative feedback, which is really, what are we doing well? What are you really excelling at, and what are you doing well? And then constructive feedback, so suggestions about how we can get better. So really, when we have our learners set goals before we observe them, it really makes them easier to get feedback, and it really gives you some insight into what they want to learn and what they want feedback on. So I found that to really be helpful with giving feedback, especially to kind of like those middle of the road or really excellent students, like asking them what they want to get feedback on. One of the things that also helped me was really thinking about feedback from a different perspective. And so this book by Doug Lemov, The Coach's Guide to Teaching, really kind of helped me think about what feedback really is. So setting an expectation of feedback is just no big deal. It's what we do. It's every day. It's the coach giving tips during practice, right? We're practicing every day. That's why we practice medicine. And so giving every single day feedback really makes it low stakes. It's not a big deal. And it kind of takes that stigma away. One of the things that he says that's really helpful in giving feedback is just 2 sentences. I like how you did whatever, right? So I like how your presentations were really organized. But next time, try to make sure that your labs and summary statement is part of the labs, not the summary statement, right? And then really thinking about feedback as a positive. I think we often really kind of critique the past, right? We think about, here are the things you did wrong, or don't do this, or whatever, right? And that's kind of a negative connotation. So thinking about it from the perspective of next time, try this, it really helps kind of them focus on the solution. And so that's sort of the way I think about feedback, and the way I kind of give feedback to learners every day is just to make it sort of no big deal and take that stigma away from the feedback itself.
Do you ask your students to give you different goals every day, or they're just sort of working on the same goal throughout the week?
Yeah, that's a great question. I usually have them set a goal at the beginning and then observe them kind of over and over with that goal. I observe them and kind of give them feedback, and then kind of let them alter course and then try again.
So some other problems that I have is when I really do have a student who's struggling and I have to give that negative feedback, I'm really just dreading it. I don't want to hurt their feelings, but like you said, with this initial one, I want them to get better and I want them to succeed. but I'm really worried how they're going to take it. And if they think I don't like them or think they're never going to be a good doctor because I'm giving them this negative feedback. So how do you approach that?
Yeah, I think, like you said, that's super common, right? You're afraid of hurting people's feelings. You're afraid of really, again, like making people cry. One of the things that I think about is sort of that formative kind of feedback is that everyday kind of feedback where we take that stigma out of it, make it really low stakes, but everybody also needs a grade, right? They need that evaluation feedback, right? That sort of Feedback Friday, if you will, if you have that at your institution, we have it at ours, or those kind of big check-ins. And I think everybody, regardless of whether they're a struggling learner or whether they're a really awesome learner, deserves that sort of more formal feedback. The way that I actually have worked on formal feedback is using this model for breaking bad news that was published in the palliative care literature by Drs. Thomas and Arnold. This protocol is really for breaking bad news to patients. But if you can use that sort of same sort of thought process that potentially like feedback, maybe that formal feedback maybe is bad news, that you have something that you're going to tell them that they're not up to par. And so the way that I think about that is really thinking about it in this framework. So, setting up the interview, providing a safe environment. So find a place that's conducive for you to talk privately, assessing perception. So what do they think is going on? So diagnose the learner. Do they have insight into what they're doing and what kind of things they do well at and what are they struggling with? Then obtaining an invitation. So what's the warning shot? Can I give you some feedback? Or my guess is that they know it's coming right at this point where you pulled them into a private room. And then really give the knowledge to the patient, really describe the behavior. So what was it that you had that they were struggling with? What behavior did you observe that was troublesome to you? And then be prepared for emotions, right? It's serious news. So expect an emotional response. They're going to feel judged. Maybe they might take it personally, but just remember and remind them that really this is just to make them better, right? Feedback is to help people improve. And don't backpedal. So that's the big thing that people do is like, they sort of feel bad and then they freak out and they justify like, oh, well, maybe it wasn't so bad. Or maybe, maybe I'm overreacting or right. Or they backpedal. Own the feedback that you gave them. Obviously, it's something that you wanted to give them, right? Some feedback that you wanted to give them. So own that feedback and just let them be in their emotions for a minute and respond with empathy. And then focus on the next steps, right? Everybody, if we focus on the future, we'll do better. So what are the next steps? Here's how you can get over this. Here's how you can move on. Here's how you can improve. And that's something I've really found that's really helpful. I also think that the one other thing that I would say about feedback is that feedback is really not helpful unless you use the feedback and let them use the feedback. So really feedback is give them feedback, watch for improvement, give more feedback. Otherwise, it's really not helpful. So one of the things that you can do is really give them feedback, maybe on Feedback Friday. So week 1 and then maybe week 2 to sort of help them improve upon that. And if you can't give them feedback, give sign out to maybe the next attending that's coming on. Like, here's what they're working on. Here's what they want to be observed on. And then also give them appreciation for change. Like if they make a positive change, acknowledge that and give them praise.
Yeah. I definitely struggle with this for Feedback Fridays because we sometimes only work 1 week at a time with the student. So I feel like I give them feedback and then I never see them again and I assume that they're going to improve, but I don't really know. And then it's hard to write my evaluation and their grade because again, putting that down that there was something negative and not knowing what happens is hard. So I appreciate that. I should be doing it earlier and really checking in and seeing how they're doing so I can comment on that.
Yeah, if you're only on for a week, I make sure to give them kind of feedback after a couple of days, and really only you need a couple of days to see some improvement. So, okay. Well, I hope that helps. If there's anything else that you need, certainly let me know.
Sounds good. Thanks so much, Dan.
Awesome. Good luck.
Thanks.